So we've talked about the ABCs of diabetes, the A1C, the blood pressure, and the cholesterol. But we have to also start thinking about other things. One of the things we have to think about when we have diabetes is, are my feet okay? So when you go to see your primary doctor should be looking at your feet and do what's called a monofilament test. It's just a little plastic filament or a little wire, plastic, doesn't hurt, where they check sensations on your feet and they look for calluses, they look for ulcers, but you should do that yourself too. Look for a thickening of the skin, look for some breakdown in the skin, because those could be areas where you could have problems. You could have problems such as infections, and if an infection sets in, you know that with diabetes it's hard to treat. So looking at your feet is important. One support that is available to you for your feet is a podiatrist, and a podiatrist is a foot doctor who helps you take care of your feet. So that could be something that you and your primary care doctor could negotiate as to when you should be seeing a podiatrist. Particularly if you have thickening of the skin or you have some breakdown in the skin, you really should be under the care of a podiatrist, at least till those problems are taken care of. The other place to think about with diabetes is teeth. Gum disease is fairly common in patients with diabetes. And when you see your dentist, which you should for your cleaning every 6 months or maybe a year, depending on what your dentist has decided for you, you should let your dentist know if you have diabetes, because then they'll take, they might want to increase the frequency of your visits, because dental disease is important, and that's something else that one needs to think about. Now, some of you might say, okay, I don't have thickening on the soles of my feet, and I don't have any breakdown in the skin, but my feet burn all the time. That could be a sign of a condition called neuropathy, where if the diabetes has not been kept under control for some time, you could have damage to the nerves. That's something you might want to discuss if you have a podiatrist, with your podiatrist, or with your primary doctor, or with your specialist. In some instances, they might give you some medications to help with the burning. Other times, they might want to do some more testing to see if the nerves are truly damaged and how badly they're damaged, in which case you might have to go and see a neurologist who might have some medications that they might want to give you. But beyond the ABCs, diabetes is one of those conditions where preventive care becomes paramount. Looking after your feet, looking after your teeth, going to see the eye doctor once a year at least, making sure that your doctor is checking your kidney function to see that you're not leaking any protein in your urine. All of these things become important. Flu vaccines, pneumonia vaccines, they can become important for patients with diabetes, because you know if you have diabetes, if you get the flu, it's much harder for you to shake it off than for somebody else who doesn't have diabetes. So taking your preventive vaccination becomes an important element of your care. So from a diabetes perspective, I think to think about it as, yes, you are in charge. The ABCs are the foundation to it. The foundation to achieving those ABCs is seeing a diabetes educator. Along with this goes preventive care, once a year visit to the eye doctors, seeing your dentist for regular cleaning and letting them know that you have diabetes, and looking at your feet all the time to make sure that there is no breakdown in the skin and there's no thickening of the skin. Those would be important issues to think about. Along with all of this, make sure you take your preventive vaccinations every year.